Hi guys, and welcome back to Working Body Wednesdays. My name is Dr. Chris Sovey of Healthy Consumer Physical Therapy in Lansing, Michigan. Today we're going to be talking about some practical things that you can do to help reduce the amount of tightness that you might have in your hips, especially if you're an office worker or somebody that's having to sit for the majority of the day. When we're looking at the structure of the hips, we're going to just briefly touch on a couple things here. I'm going to give you some things that you can put into practice today to stop the amount of tightness that you're getting in your hips. Now, first thing is to think about the ergonomics of how you're sitting. If you're somebody that has to sit in a chair, it's certainly worth having an ergonomic assessment. I want to say from a overall big lifestyle perspective, if you're in some type of profession where you have the ability to get a sit-to-stand desk, I highly encourage you do that. Now, standing isn't all the rage either because it can have some of its own issues. It's the variety of movement that you really want to have in your workday. I, for one, have a treadmill desk that I put underneath my standing desk, and I use that to help me to create some variety in my movement throughout the day if I'm having to do a lot of paperwork. So it's highly encouraged that you find a way to adapt your working environment, especially if it's a job that you're going to be in for a long time. The traditional type of an ergonomic setup when we're looking at the hips is that a lot of times chairs will be set so you're at this straight angle here from the spine to the hips, so we have this 90 degrees of hip flexion. In reality, our butt should be a little higher so there's a little bit of a drop in the knees compared to the hips. So we can have more of about a 125 degree angle here. And the reason for that is if you think about the hip flexors, if they're always in this position, they're always in a shortened position. So they're more likely to become shortened quicker in this position, especially if you're not taking sitting breaks. This is also a position where if you have more hip flexion, you can create a little bit of relief on the lumbar spine as well. The more the legs are up, so the more you're a deep couch sitter, and you're in your favorite chair, the more we're going to create compression on the lumbar spine, and we're an even further, if the knees especially come above the hips, then we're in even further shortened position. So one of the best things you can do for yourself right off the bat is make sure that the way that you're sitting isn't encouraging shortening of these muscles in the first place. And second, too, is even in a position like this, you are shortening the front, and in some essence, some of this is lengthened a little bit in the back, but they have to work harder to keep you in place. So I highly encourage people to sit with a little bit of a decline angle in the knees. It's also important to think about, once again, as we talked about in Learn Your Body Thursdays last week, about the position of the pelvis. So if we are, again, tipped back here in the pelvis, we're going to create compression in the lumbar spine. All the muscles around the hips are going to react to that. If we're sitting off on one butt cheek, we're going to have another similar reaction where you'll probably have unilateral, meaning one-sided hip pain or hip tightness more than the other. Same thing if the pelvis is rotated. If you're always crossing one leg over the other, you're going to have these kind of issues that you're going to have one-sided issues because you're going to have a twist in your pelvis or even up into your lumbar spine, which is certainly not ideal. So if you're somebody that has to sit for the majority of the day, what I'm saying here is I highly encourage you to have an environment where you have some variety in your movement. You're able to get up and get down. Get up at least once every hour. So, every 50 minutes or so, you're going to get up. Even if you just stand up and walk around for a couple minutes, do some stretches, move the legs around, that's going to help you a lot more because the longer you sit for a prolonged period of time, the more chance you have of those muscles permanently closing down and adjusting to that new posture. So we want to get variety in the movement. We want to make sure that we're sitting properly, and we want to make sure that we're not sitting in a position that's creating more compression in your back or in your hips. There's tons of stretching programs out there, hip mobility programs that you can check out. I'm not going to get into that here because that's more of an individualized kind of thing. I want to give you some lifestyle things that you can do right off the bat, and you can put those into practice. So what are the kind of things that you do to keep your hips loose and mobile throughout the day. What has worked the best for you? I'd love to hear about it in the comments section below. This has been another episode of Working Body Wednesdays. If you enjoyed this video, be sure to subscribe, hit the little bell so you never miss another video again. I look forward to seeing you next time.